My name is Ed Schenkenberg. I'm the director of HERE, the Humanitarian Exchange and Research Center based in Geneva. HERE is committed to closing the gap between policy and humanitarian practice. Through research and exchange, we work to improve the collective performance and effectiveness of humanitarian action. As part of our exchange, I will be talking to 4 humanitarian leaders about the work of their organizations in response to the COVID-19 pandemic. I will be talking with Christina Bennett of the START Network, Kostas Moskokorotis of the Italian NGO Intersos, Raphael Gorgeu of MSF, and Cecile Abtel of the International Federation of Red Cross and Red Crescent Societies about the work of their organizations in response to this crisis. On Wednesday, the 8th of April, I will be moderating a debate with all 4 of them to discuss the implications of this crisis on the future of humanitarian response. I hope you will join me online and don't hesitate to ask your questions through Twitter, email, or on LinkedIn. Christina, the START network, a large network of more than 50 organizations, many international NGOs, many also national NGOs, to me in the past has been referred to as the SURF for NGOs. I'm not sure if that's true, but perhaps you could explain in a few words what exactly START network is and what it is doing.
Sure. Thanks very much, Ed, and thanks for allowing me to be a part of this discussion. Obviously, COVID-19 is enabling all of us to kind of pivot to a new crisis and perhaps create some opportunities for changing the way that the system works in the process. So START Network, as you said, is a membership organization. We're a network of more than 50 humanitarian NGOs and civil society groups operating across 5 continents. You know, the aim of START Network is not to represent the biggest in the international system, but really represent the diversity of what the humanitarian system is in countries where there are crises around the world. And really our aim is to change the way that humanitarian aid operates. And based on sort of 3 key almost pathologies that we see in the humanitarian sector. One, that we are slow and responsive, where we don't need to be. We could be much more proactive in the way we do things. 2, that we make decisions very, very far away from front lines, whereas we could be much more decentralized in making decisions much closer to front lines, which creates a lot of disconnects in terms of decision making and also power imbalances in terms of the way we work. And also that there are creative solutions at community level, innovative solutions that we don't really tap into because we are focused on our own mandates and the way that we've always done things.
Thanks for that. So in that sense, the way I understand it, you're much more, and maybe even wouldn't qualify yourself as a donor. But I understand that particularly in the response to COVID-19, you have developed a specific fund. So perhaps you could say a few more things on that.
Sure, thanks. Yeah, I mean, today at 9 o'clock this morning, we launched Start Fund COVID-19. And this very much in response to a few things. One, we were getting increasing calls from our members to be able to respond to to preparations for and the incidence of coronavirus in the countries in which our members work. And we didn't see a lot of speed in the way that other funds were coming online. Also, I think as START Fund, START Network, we have a lot to offer this response in terms of the way that we've always worked. As I said earlier, we're a network of more than 50 NGOs who already have global reach and expertise, not only in public health and pandemics, but also in some of the wider humanitarian implications that this response or that this crisis will inevitably bring on. We also know how to engage directly with communities on responses. And if there are any lessons to be learned from the Ebola crisis, for example, responses at community level or activities at community level are really critical to stopping the spread of a virus such as coronavirus. But also, we are a fund that works not only in response to crises, but in anticipation of crises. A large percentage of the way that our members use the START Fund, the existing START Fund, is in advance of a crisis that is perhaps known because there's been a trigger, because there's been a weather forecast, and we can get money to them early to be able to mitigate the effects of that crisis before it happens. So all of that, I guess, our members came to us with increased demands to be able to respond or in advance of and in response to coronavirus, and we thought it was really important to get this up and running. So with an initial pledge from, or initial grant from the IKEA Foundation of 1.5 million euros, we've launched this fund. But, as I said, in the past few hours since this fund has been live, we've had 9 requests from 9 different countries around the world to access the fund for their own coronavirus preparations.
Sorry to interrupt, but you means that, of course, there are high expectations, I presume, from a number of your members that they can draw from that funds while funds are coming in, particularly with the travel restrictions and so on that are in place. I imagine that for international NGOs, it's more difficult to work, if you like, overseas as such. And in fact, some of them may be even requested to work in their, what usually has been called their home countries. So do you expect that funding is more likely to go to activities at the national level, so to speak, particularly also to your to the NGOs that are national members, or how would you expect this to happen?
Yeah, well, I think what will happen, it's both because of the size of the fund and the size of our allocations, which, when you compare them to the SURF or the country-based pooled funds, are relatively small, and that's by design. Because what we're aiming at here is to really make sure that the money is going to very, very kind of to the gaps, I suppose, in the response, to those areas, those underfunded areas, those overlooked geographies, people, activities that are really required in this kind of a response, but that will be overlooked by the bigger funds. In terms of the way that our members work, yes, a lot of them that are international are being pulled out of countries. We saw that international organizations were being asked to leave Cox's Bazar, for example. But, just by design and by the way our members already work, they work through local partners. And in some ways, we can be funding local organizations directly in some instances. So we expect that a lot of the use of our funds is going to be used at community level, at national level, by local organizations who are able to operate and have access to communities in country. That's not to say that they don't have their own issues, but
right. Who will then decide on the priorities? Because I imagine that obviously COVID-19 is dominating everything logically, but at the same time they also have their ongoing programs. So how do you expect they're able to, to work out the various priorities?
Well, maybe 2 things on that. First, when we first brought this to our members last week, we got a very clear signal from them that anything that we did on COVID-19 could not be at the expense of existing programming. That it was important both for the transmission of the virus, but also to be able to sustain ongoing programs, that we couldn't be using the money in the START fund that's used for ongoing emergencies for COVID-19, which is the reason why we set up a dedicated and separate fund. But in terms of how we allocate the money and who makes the decisions as to where it goes, that's actually the beauty of the way that the START fund works. All of our decisions are made at ground level by groups of organizations that get together themselves and activate alerts themselves based on some information they have, and also third-party information. And then together as a cohort, they decide how much money, what activities, and who gets the money in order to be able to implement those activities based on the coverage, based on the needs, based on what organization is best placed to do what. As START Network, we have very little to do with that decision making. We facilitate the meetings, we provide the platforms for the discussions, we provide some guidance, but we really have nothing to do with the decision as to how that money is used. Those decisions are made by organizations on the ground.
Right. Maybe, obviously one expectation is that this crisis, and particularly the response also to it from humanitarian organizations, may put further emphasis on the agenda to localize humanitarian aid. More on the role of organizations that work at the national and the local level. That may be a positive development, but at the same time, it may have a downside that it may play in the sense that it may play in the hands of those that are keen to close borders and perhaps, keen to defend an agenda or promote an agenda of protectionism and so on. How do you see that? The pluses and the minuses, so to speak, of the localization agenda.
Yeah, well, I think there's two sides to that, as you've just said. I mean, I think working through local organizations now is critically important, both because of the access issues that we just described, but also, this is a very, as we know from our own countries, responding to coronavirus is a very local proposition, right? There are clusters that the virus, moves through that require highly targeted responses, whether you're talking about medical responses or even just community, social distancing or lockdowns and things like that. So, both because of the nature of the virus and the way it moves, but also because of the access issues, this has got to be a much more local response than we're used to. But also, going back to what we've learned from the Ebola crisis, I mean, communities and community organizations, local organizations can do so much, not only to kind of mitigate fear, reduce mistrust in the health systems, promote appropriate public messaging, set up things like hand washing stations in marketplaces. These were things that really did help stop Ebola. And that will help stop coronavirus if employed quickly and effectively. So, there's lots to be said for community engagement and the engagement of local organizations in this response. It will be absolutely critical. But as you say, there could be sort of a backlash, and I think we're already seeing it. Governments, including our own governments, have reacted to this by closing borders. They've reacted to this by saying this is, we have to protect our own in order to mitigate the effects of this virus. It's almost a securitization of the virus. It becomes a national security concern instead of one that's about individuals and helping individual people. I think, I think the effects of this are going to be terrible for affected populations. We see this already in Bangladesh, where not only are international organizations now not able to operate in Cox's Bazar, but we're also seeing, certain treatment of refugees in Cox's Bazar that demonstrate that the government isn't really necessarily that interested in helping them and aren't going to be able to provide them with the food, with the medical attention that they're going to need in a situation where the virus is going to be prevalent. I think that, this is a virus, this is a disease that doesn't have borders. And in order for us to be able to put it out, we have to put it out everywhere. It's a borderless situation. So while we protect ourselves by closing our borders, we're actually, going to reduce the impact of all of these, of all of our responses by not doing it everywhere. So I think, the message that we as humanitarians need to be sending, to our partners is that this is a response that we have to enable you to respond effectively, but also we need to be sending a message to our governments. You need to be taking a wider view of this response. It's not all about retreating to your protectionist tendencies. You have to model good behavior in terms of the way you act, and so that you can encourage other governments that may also want to close their borders to act in similar ways. And that really, in order to be able to stamp this out, we need to be operating cross-border across the world and not retreat into our own cocoons and say that we won't be open to helping others. So I think, there's a real balance between what we see as protecting ourselves, but not at the expense of helping individuals elsewhere.
Perhaps to go, obviously we don't have a crystal ball at our disposal, and obviously there's a lot of perhaps, dare I say, anxiety in terms of what humanitarian funding might look like, or might, what the pot for humanitarian money might be in the future. So in that sense, I imagine there's a lot of expectation towards particularly the START fund, the particular COVID fund that you have developed now and that you're launching today. But any thoughts in terms of, how actually, what the resources might look like in, let's say, at least the coming months?
Yeah, no, I don't. I have no idea. How long is a piece of string? I think the tension on this is going to be, countries, governments are going broke just helping their own citizens. And I think that's obviously the right thing to do in terms of their own first response to, and their own responsibilities to their citizens. What that means to ODA, what that means to, available funds and support for for things outside of their countries, I think governments will be under increased pressure to restrict those international activities, because they're going to need the money at home. And I think, again, there's a balance to be had there. I think, we can't be just looking internally as to how we deal with this. And, but I think it will take a little bit of time to suss out exactly what the impact on overseas, on ODA and aid will be in the long term. I know from talking to our members and other philanthropic groups that they are thinking of this in terms of 3 kind of phases, one much more about prevention and response, one much more about recovery, and one about resilience. And that's really going to be about health systems and how do we support those in future. So, this is not something that is going to go away once this the initial arc of this epidemic is complete. We're going to be.
Perhaps there is a last question, and Christina. I mean, obviously earlier, I think it was end of last week, the UN put out an appeal for 2 billion. Yeah. The Red Cross, Red Crescent movement has its appeal out. Are you coordinating? Are you in conversations with those networks?
Yeah, so we are speaking to both the Red Cross and OCHA, who are our partners in many aspects of what we do at START Network. And I know that we understand each other as representing sort of different, I guess, pillars, if you will, of the response. That, we represent a group of civil society organizations, some of which don't have access to some of those larger funds. And so we all need to be working together and coordinating quite closely in order to be able to mount the most effective and efficient response we can. So it's not a matter of either or. I think the world needs all of us working in tandem and in concert on this, because we do represent different levels and aspects of the response.
Thank you for that. Christina Bennett, really good talking to you today, and particularly also precisely on the day that you're launching a very important resource for NGOs. So thanks so much for sharing your views. As I've mentioned, we will be discussing this in a live forum with 3 other humanitarian leaders on Wednesday, 8th of April at 1 p.m. Central European time. Christina, thank you so much for now. Good luck with getting the COVID fund in place.